my biggest role is around coordinating something new about the way long-term conditions are managed, where some of the stuff we've been hearing in the last couple of days is already starting to sound relevant and I have to say quite exciting. So yeah, my lead part there, somebody else is doing referrals, somebody else is doing a lot of work on prescribing. Rotham's already done a lot of work on that. But the big one, the black hole one that's not been tackled in any effective way is how do we start to tackle long-term conditions and how they are managed, especially in view of their resource use.
I think it's trying to embrace the new leaders that are coming through the system. We don't yet have clarity on what the what nationally will be dictated in terms of configuration of organisations, but we need to embrace those energetic and enthusiastic GPs who want to work with us to change the system. And regardless of all the debate about the health bill and everything, those people are already emerging and are already starting to change the way that we do things through joint working and joint sharing of ideas of what needs to be done.
One of the things that I felt about Barnsley Hospital when I first went there about 18 months ago was this is an organisation that has had things done to it. They're not part of it. And that's then reflected down at divisional level. And some of that is then they don't actually know how to react and behave. So it isn't that they don't want to, they just don't know how to. And I think the big thing for me is enabling them to know how to make the changes themselves rather than have them imposed on them, which is what's happened in the past.
Its luxury is that it gives me space for the strategic. I also quite like this models bit that we're having at the moment, because just occasionally somebody from a completely different background saying, you realise that actually this is different from this and requires a different approach, can be, what do they call it, one of those sort of aha moments. Oh, yes.
Being challenged myself personally, actually having to think very differently about how I work and the impact that I have, but also, I guess, the opportunity to work with others in this network to really make a difference in Yorkshire and Humber.